Welcome back to the Comfortable Show. This is a show where we sit back and discuss about issues affecting our community at large. But today we are doing it a bit differently because we are measuring on female reproductive health, and joined by a public health officer here. He's going to introduce himself before we get down to the convo of the day. Karibu sana.
Thank you.
Yes.
My name is Meltas Machimbo. I'm a public health officer and I'm also a private researcher, mainly in the field of public health. And today, as you've been introduced, we are going to talk about the special issues that a mother should know, or what a mother should have at the fingertips when doing a gynecological visit to any facility. Usually, mothers, or say women, do not understand what they're supposed to do or what to say when they're going for a gynecological visit to any physician or a gynecologist. No, I would just want to highlight the different things that a mother should have, or what they should expect from the gynecologist. The topic will cover women of different ages, of course starting from adolescent through to adulthood, and then middle adulthood, and older women beyond 65 years and above.
Mr. Machimbo, before you continue, yes, I'd like to understand why is it that you're excluding the women, okay, the ladies or the young ladies under the age of adolescence?
Usually, children under the age of 12 are normally treated as under pediatrics. Understand?
Okay.
Yeah, so they're handled by pediatricians.
All right.
They're not handled by gynecologists. You understand?
Okay.
So, right from the age of from puberty,
yes,
that's when different gynecological issues emerge among women. We're talking about the menarche, or menarche, if you can say. So, menarche is the age or the first time that a woman experiences her menstrual periods. So mostly it's between, it starts from the age of 12. Mostly the earliest is around the age of 12. The first time a woman can experience menstrual period, the monthly periods.
What happens to those girls who start their first menses at the age of 9 and below? Or do you think it's a normal thing, or
it's very rare? And from my research, the very rare cases where menarche starts from not even below 10.
Yeah. So is it
normally
a normal
the
thing?
average is 12. Yeah. But there are those who normally have their menarche or their first menses at around 15 years. So that's called late menarche.
Okay.
Yeah. Now, so these are the people I'm going to cover from adolescent through to adulthood. But the kids are not handled that, because when they go to the facility, they are handled under the pediatrics department. Let's go to what you'll expect from a gynecologist in the first meeting. Regardless of what symptoms you may have, unless it's an emergency, and still you'll need to, the physician will still need to document a few things about you. So mainly, of course, they'll start with your name, your gender, and your age. And in countries where the people from different races, you'll be asked, of course, you'll indicate your race. You understand?
Okay.
Yeah. Then, of course, you give the chief complaint. You go to a hospital, maybe you'll be asked about your chief complaint. What brings you here? You understand? You can say maybe I'm here, I'm having a discharge. Understand? Or I'm having postcoital bleeding.
What is postcoital bleeding?
Postcoital bleeding. You understand coitus, like bleeding after sex. Yeah. So I'll talk about it later when we're doing when you will looking at the profiling of a woman when doing now the gynecological assessment.
Okay.
Yeah. So we'll come to that. So of course you'll give the chief complaint. You can say I'm having these kinds of pain, maybe lower abdominal pain. So you'll be asked to describe that kind of pain. When did this pain start? That's the onset of the pain. When did it start? And then you'll be asked the location. So you'll say maybe the lower abdominal part. You'll just indicate where you're feeling the pain. Understand? Or anywhere else. You could be having symptoms anywhere else. You can say you're having pains maybe in your body somewhere else. And that could indicate maybe intimate partner violence. Maybe you've been hit, because those are the issues that women face in different homes, in different societies.
Okay.
You understand? So we are not only looking at the gynecological risks that someone faces, we're also looking at the physical and safety, environmental safety issues. So you'll describe your symptoms. You'll indicate the location of that pain. Understand? And then you indicate the duration. For how long has this pain been there? You understand? Because a mother can come to the facility and maybe she's having labor, because the kind of pains that they experience during labor is that it's an accelerating kind of pain.
So the kind of pain that
so you have to describe the duration. How long has it been? And then you have to describe the characteristics of the pain. Okay. You understand? So the characteristics, you can say this pain is burning, this is a sharp pain, this is a stabbing pain, and this is a burning pain. So that kind of burn. For example, when you say maybe you're having some kind of burning pain during what? During, let's say, urination, you get. That's an indication of an STI, probably. STI is sexually transmitted infection. Okay. So like that, you have to say the characteristics. So when you say burning, and the physician will understand what kind of pain that is. Then they'll start, because what they're trying to get is what is the main diagnosis. Because at the end of the day, you'll have to be treated for a given condition. You understand? Yeah. So mainly, this information is going to lead the physician to your main problem. You understand? He'll reach at a point where, based on the information you have given, you understand? He will determine whether you have an STI, you are maybe undergoing true labor. You understand? Or maybe you're still you have STI, or you have anything like that. So after taking the characteristics, you look at the associated symptoms. There can be a main symptom, there's a pain, but there's other symptoms. You understand? For example, you may have a fever, you may have sore throat. The different conditions that normally present with sore throat, and at the same time have vaginal presentation. You understand? For example, gonorrhea or gonorrhea. You may have that bleeding, and then you have a discharge, green or yellow, but at the same time you have a sore throat infection that can last for more than 2-3 weeks, kind of. before the patient presents the facility. You understand? So you have to indicate the associated symptoms other than the ones that you know. And then we come to the relieving factors. The physician will ask you, what have you tried to do so that what kind of thing you do or exercise you do can relieve this factor or has aggravated this factor. You understand? For example, you can have a pain, but when you are in a different position, maybe say you squat, the pain goes away. I just talked about the relieving factors and the aggravating factors. Yeah. So mostly a mother will say when I rest, the pain goes away, or maybe when I work, for example, a pain that is caused by exertion. Let's say maybe, no, this is outside gynecology, but someone has arthritis. When they bear a lot of weight, they'll have to feel the pain. You understand? So you'll state the relieving factors or the aggravating factors. Aggravating factors mean when I do this thing, there's more pain. But when I do this thing, there's
a lot of pain. Okay.
You understand? Now the final thing about the symptoms, you will be asked about severity. Usually, severity of the symptom, of the main symptom now. For example, you said my pain is somewhere, at the lower abdomen. What is the severity? Out of 10, how can you rate this pain? You understand? 0 means no pain. 10 means the worst pain that you can imagine. Sometimes when it's labor, someone can say it's even beyond 10. You understand? So that's what happens. So when the physician has that pain, that rating of yourself, because you'll set it yourself. You understand? There's pain that can be withstood, and someone can manage to withstand that pain, but there's pain that is beyond, and there's also pain that is continuous. So that's mainly the main thing about the main symptom that will be asked. About the general history now, we'll ask about whether there are any health conditions that are not related to the major symptom. Or we also ask what previous serious illnesses have you suffered before, because mostly the previous illnesses inform or maybe determine the current
illness.
Yeah. For example, if you had an STI previously, you understand, and it was treated, maybe the regimen that was used was not, the kind of medication that was used was not effective or did not have that sufficient efficacy to clear the disease.
Okay.
So it is a re-emergency of the same disease. Or sometimes we have resistance. For example, diseases such as trachomatis or trichomoniasis.
Yes.
You understand?
Yes.
It's an STI that can be resistant to the main medicine that is used. And you understand? So we are looking at the history of the previous illness. And then you come and look at whether the patient has been hospitalized before. So the mother will say, I've been treated for this condition before. If you've not been treated even in the recent past, you indicate you've not been hospitalized in any way. And then you look at the kind of surgeries they have undergone before. You understand?
So how is surgeries affecting this?
A patient has said, I have pain somewhere. You understand? Let's say a mother had her initial birth, maybe the first pregnancy, she gave birth through a cesarean section. You understand?
Maybe the wound is not healed or something.
Maybe the wound is not healed, or maybe she had some complications that are related to the wound. Okay. You understand?
All right.
So the wound could be healed, but maybe she has some other factors that are affecting that wound.
Okay.
You understand?
All right.
Because this visit is at any time of the year.
Okay.
The mother might come at any time, you understand? Maybe 2 months after giving birth, or 3, or you understand, or even some time later. So you have to get the kind of surgeries they had before. And these surgeries also will inform on what you're going to do as a physician. You understand? And then you ask their vaccinations, whether they are up to date with vaccinations. You understand? So mainly a mother who is due for, maybe who is pregnant, they lead up tetanus vaccination. So you ask if they've been vaccinated or not, depending on the time of they visit the facility. In the US mostly, or these other European countries, will be asked for a flu vaccination, season of flu vaccination, because flu is very dangerous in those regions. You understand? Yeah, now that's the general. And then about the mental health history, you have also to capture about the mental health history. You look at this mother and ask, do you have any mental concern currently? For example, depression or anxiety. Depression can come because of any traumatic event. For example, a loss of a partner, maybe in the recent past, a loss of a child, a loss of a pregnancy, you understand? Or maybe any kind of trauma that might bring about depression. So we are looking at different risks in the home setting, in the community setting. You understand? Yeah. Now we have still under the safety assessment, you will expect questions about, have you had any traumatic sexual encounter? Understand? With your partner or someone else in the community. So you have to state that, and you have to state when that happened, because that could be related to the current symptoms. Yeah. And then you come to now personal habits. People have specific personal habits that can influence their health. Understand? A mother can be obese simply because they lead a sedentary lifestyle, where they just eat, they don't exercise, they don't take any walks. Understand? If they want to go outside, maybe they have a vehicle, so they can drive themselves to that place and then come back and still maintain that sedentary lifestyle. Understand? Yeah. So personal habits determine your health, and then you also ask the quality of their sleep. Yeah. 8 hours sleep or 6 to 8 hours sleep is enough. Is the most recommended. You understand? If a person has less than that, it's likely they will have mental health issues and also other related conditions. Because you have anxiety, maybe someone has anxiety. Insomnia is a medical condition. You understand? So you'll be expected to be asked about those questions, because insomnia can affect your daytime performance. It also puts you at risk, especially when you're working in the industrial perspective, where you're asleep during the day. Maybe you're running a plant, or they're running a dangerous process. Yeah, and you ask the mother should also expect questions about hydration, because normally a person is supposed to take 8 glasses of water on a day. So you'll be asked about your hydration behavior and whether you have a balanced diet, because malnutrition is a critical condition, especially during pregnancy. Yeah. There's anemia, where someone does not have enough iron. Yeah. And it's very dangerous, especially during pregnancy. Yeah. And then you come to, of course, still we have to profile about the dental checkup, if they do dental checkups, or if they go for eye examination. Yeah. So that's about personal habits. Now we come to specifics about gynecologic history, because the first part that I've been talking about was mainly a general health history that everyone must be asked. Understand? Whether it's a woman or a man, it will almost take the same approach. Yeah. Now about gynecologic history, the first main thing that will be asked about is about your menstruation history. So under menstruation history, you will ask about you. The last time you experienced your menstrual flow. You understand? When was the last time? So once you have also to state the number of days the flow takes and the length of your menstrual cycle. Yeah, because it may someone might not remember their last menstrual cycle, and they could be at risk of being pregnant right now. And at times, the pregnancy might be unwanted, air quotes. You understand?
Okay.
So, or a mother might be around 47, 48, or 45 and above. And then she comes to the facility and says, I think I'm in my menopause because the last time I experienced my menses was 8 months ago, 8 to 9 months ago. You understand?
Yeah.
But maybe and in that case, maybe she's diabetic, or she's not diabetic, she's obese. At that point, she's telling you she had her menses 8 months ago. But the presenting symptoms right now is that excruciating lower abdominal pain. Understand? She says this leakage, vaginal leakage, and then on assessment, you find that the cervix is slightly open. Understand? And her presenting symptoms are actually that she is in true labor, but she doesn't know that she's been pregnant or those 8 months.
Exactly.
You understand?
Yes.
So the patient the mother should expect to be asked about those questions, because you have to state your last menstrual flow, the number of days, and the length of the menstrual cycle. If that length is beyond, you'll have to be screened for pregnancy, the HCG test. Understand?
Yes.
And then the number of course, the regularity of the menstrual period. Is it regular? Is it because this mother may need advice on how she can use contraceptives. Understand? So that regularity or the state of how it appears, it happens, or when it depends, and the length, you understand, determines the type of contraceptive that can be prescribed for you. So if you have irregular periods and therefore you cannot determine your safe days per se, it's good to use what we call barrier contraceptives. Barrier contraceptives is like there's a barrier, a condom, a male condom, you understand? Yeah. To avoid STDs mostly, we also recommend using barrier contraceptives, mostly condoms. Yeah, because the people you may be having several sexual partners. So it's safer to use a condom than using intrauterine contraceptive device, IUCD, or a coil. That's what it's called. Yeah.
Okay.
Then, of course, we'll ask about the characteristics of the menstrual flow, whether it's clotting or how it looks like. Because sometimes that menstrual flow can combine with bleeding beyond the cervix, you understand? So a combination of the menstrual flow and normal blood or the discharge can bring about a different color of the
menses.
Yes.
Okay, I think we need to expound on that a little bit, because
okay, let's say someone has gonorrhea. You'd expect green or yellowish discharge. You understand? This discharge comes at the same time that you're having your menses.
Okay.
You not expect the kind
A
of
flow.
a normal flow that someone else that has no condition absolutely to have the same kind of color. You understand?
All right.
I talked about menopausal and premenopausal. So mostly mothers who are menopausal, they should also state when they last expressed their menses. If they're not pregnant, of course, that means they might be having other conditions to check out. Let's meet in the next episode when we finalize on the gynecologic health history of a mother. And once again, I was talking about what a mother should have at the fingertips when visiting a facility for a gynecological health assessment.